Thank you, everybody. Also presenting on behalf of our med student, Madeline Matthys, on quantifying the carbon footprint premium of robotic surgery. So thank you for your time. We're clearly in the middle of a revolution in robotic surgery. It's the new frontier of minimally invasive approaches. And those of us on the sustainability side are understandably concerned whether or not the advent of additional robotic surgery is going to be more wasteful without a meaningful increase in clinical benefit. There has been limited research in this space. A recent review found that a few robotic operations had higher carbon footprints than their laparoscopic alternatives, but this was only done in a few cases, like hysterectomy, for example. And the reason for that is it's actually very hard to understand the carbon footprint of an operation. The limited times this has been done, it's been done with a methodology called life cycle analysis, or LCA. And LCA is really a cradle-to-grave assessment of the carbon footprint of a process throughout all its stages, from the procurement of raw materials all the way to disposal. LCA is kind of like a gold standard. You can think of LCA and sustainability how we think of randomized trials in clinical research, but it comes at a trade-off. It's highly expensive, it requires specialized consultants, and it's time-consuming, and it's also difficult to scale. So you can do maybe one operation at a time, but it's hard to analyze all the operations over a year or even across a division. So our aim is to understand, can we build a more scalable methodology to compare the carbon footprint of lap and robotic operations? We have some experience at this at UCSF. We built a model where we assumed that the carbon footprint of an operation is really the sum of the footprint of the sterilizable instruments and the disposable supplies. For sterilizable instruments, we multiply the number of trays by the energy required to sterilize each tray, and that number is provided from our sterile department. And for the carbon footprint of supplies, we multiply the cost of the supplies by what we call the emissions factor. And this is a number generated by the United States Environmental Protection Agency that converts dollars in supply cost to carbon footprint. And together, that gives us a rough estimate of carbon footprint. It's not a perfect model, but it is one that we think is useful. And the orders of magnitude in carbon footprint we estimate are similar to those in LCA. So with that context in mind, we wanted to take a look specifically at the main hospital site of UCSF, a comparison of laparoscopic and robotic operations. There were 4 operations that were performed both laparoscopically and robotically by at least 3 surgeons at least 10 times in the last year, and you can see the percentage breakdown here. And using the equation that I just described, we built this set of box plots, which shows you kind of the variability in several metrics, from the number of supplies, the number of instrument trays, the cost of open supplies, the cost of open and PRN supplies, and finally carbon footprint. You can see here the only operation for which the carbon footprint in robotic is significantly higher than laparoscopic is ventral hernia. And we confirmed this statistically using a Mann-Whitney U-test. Now, this is a little bit of a non-intuitive finding, no pun intended, but I think that the reason that this could be the case is that oftentimes in robotic surgery, what is traditionally in laparoscopic surgery used as a supply is classified as an instrument, because there are robotic instruments that can be used multiple times. So we'll need to make sure that our model is robust in taking into account for that. But we can conclude in this very preliminary data set that robotic operations do not always generate more carbon footprint than their laparoscopic alternatives, and it has to be studied in a case-by-case basis. This is definitely a limited model. There's several assumptions we make when using this kind of economic modeling of carbon footprint that are not as robust as LCA, but we think that this is overall a more scalable technique to look at carbon footprint across entire sectors of operations over time. Certainly more refinement will be required, and we look forward to working on that process. Thank you.